Hi, everyone. I'm Congresswoman Suzanne Bonamici. I represent Northwest Oregon, and I am so pleased to be joined today by Dr. Myra Jones-Taylor, who is the Chief Policy Officer for 0 to 3. Dr. Jones-Taylor is an expert in the field of early childhood education and a passionate and effective advocate for babies, toddlers, and their families. So thank you, everyone, for joining us today. I'm looking forward to the conversation. I want to start with just a couple comments and say that parents have been navigating these new and very challenging circumstances, like working from home and working later, different hours, and parenting with a lot less emotional reserve, managing distance learning with school-age children, and certainly less time to unwind and recharge. And since the start of the pandemic, I've heard from so many parents about the challenges they face. I put together a comprehensive report on the child care crisis, which I was actually working on before the pandemic. And I'm leading the work in Congress to stabilize and vastly improve our child care system so it works for families, children, and the people who do the important work of caring for the next generation. And I hope this conversation today will be a resource for the many moms, parents, families, childcare providers, and advocates who care so much about these issues. So before we get into the questions and conversation, Dr. Jones-Taylor, can you share a bit about your background and your work with 0 to 3?
Sure. Thank you so much for having me on this, to have this conversation with you. Really grateful for the opportunity. So, I am a parent. I have a 17-year-old and a 15-year-old, and I came to this work very much thinking about the needs of children and families. My mother, when she was raising us, relied on many public supports, including welfare and childcare support. And I come to this as a passionate advocate, making sure that all families have what they need so that they can have children that are thriving.
Well, thank you so much. We're thrilled you're with us. So let's start with the sort of general question about what are you hearing right now from parents, and you being a parent yourself, you have firsthand experience. My kids are grown, but I certainly hear a lot from parents right now. But what are you hearing about the top concerns right now, and what should our priorities be to address those concerns?
It's really simple. Families are worried about remaining in their homes. We hear that all the time. They're also worried about, if they are able to remain in their home, to paying for their utilities. Being able to afford basic things like utilities has become a major stressor on families. Childcare is a huge concern. And of course, food insecurity. We know that food lines or lines at food pantries are just as long as they are at lines, to get vaccinated. So we're very concerned about that as well. And so making sure families have childcare support, that we have the federal moratorium, eviction moratorium stays intact, and that we have some support to pay back rent as well, as a really important part of what we're advocating for.
And so when families are stressed like that, when parents are worried about, is there going to be a roof over the family? Will they have enough to eat? Where their next meal is coming from? And sometimes, will they have a job? What does that do to the family dynamic? And importantly, what does that do to children of all ages?
We are seeing so many reports of stress from families. We know that over 42% of families, according to a recent study from University of Oregon, actually out of a Rapid EC project, that 42% of families report having challenges affording at least one concern, one basic need. And when families can't provide basic needs for their families, that creates stress. It is something that is innate in us, that we want to be able to provide for our families, and we can't. It brings depression. It brings some significant anxiety that we're very worried about. And what we've also found through the Rapid EC is this has a cascading effect. When parents report stress, then the next week they report that their children are exhibiting stress. And so this is of great concern, especially when we think about young children in the earliest stages of brain development. We do not want to disrupt that critical development that's happening. And we know stress is a contributing factor on that.
And I suppose it probably varies, but do parents know? Do they have someone they can call? Do they what can they do when they're feeling that stress? And I do want to note that on a lot of the issues that you raise, that things like food insecurity and housing, we're working on policies to help there. But where do parents go? Who do they talk to? Do they have someone they can contact to help them get through this hard time?
We are major proponents of programs like home visiting, making sure that families have access to those community-based supports to help them when they have times of struggle. Programs like Healthy Steps, where you can actually talk to somebody who's in your pediatrician's office who can help you with all of these challenges, is another critical support. But this is such a widespread challenge. We need to make sure that we are supporting those community-based programs that are stretched in the midst of this crisis.
Absolutely. More need now than there would need before, but highlighted by the pandemic. One of the things that I've been hearing from parents is, especially for parents who are, frontline workers, they're still really concerned. I'm grateful that there's an increase in vaccinations and ramping up of vaccine manufacturing, and sort of trying to work on the distribution challenges, and it's getting better, but there's a lot of stress, especially for parents who are out there maybe working as in frontline workers, whether they be in healthcare or grocery stores or agricultural workers. They're out in the community, and then they're coming back home and bringing that stress of afraid that they're going to get family members sick. So any thoughts on how we can address those concerns too, about worried about, will their kids get sick, or will they get sick themselves, because we're in a pandemic.
Right, right. And so obviously vaccinations are huge. And so we are really hopeful that this will get rolled out very quickly. We also think about families who are at risk or are have tested positive or been exposed to somebody who has tested positive for COVID. We want them to have paid family and medical leave, and sick days, right? So that if they are worried about their health, that they're able to stay home and know that their job is protected, and that they can still earn, a decent wage while they are recovering or taking care of somebody else, and not spreading it throughout the community. This is a huge public health concern, and paid family leave is a major way to remedy that.
Exactly. And that's something that I've supported, pre-pandemic, but another issue that's even more important during the pandemic. I've heard a couple of heartbreaking stories about parents just feeling like they had to go to work, even if they thought they might be infected, because they had to earn the paycheck to help with the family. So that's really tough. Can you talk about the long-term stress and anxiety that is affecting parents and children? So we're going to get through the pandemic. There's light at the end of the tunnel. We still have to follow all the public health recommendations, but will there be long-term effects from the stress and anxiety, especially for the young children who are living through this right now?
We see that these effects are already happening. We're already hearing parents who are talking about children exhibiting challenging behaviors, not typical behaviors, so irritability or being withdrawn. And this is something that we are very concerned about because of the critical moment in brain development. The good news is that we can, if we have proper supports, if we have infant and early childhood mental health clinicians who are in communities who are well trained to be able to address concerns, we need to make sure that part of our infrastructure, our mental health infrastructure, is really set up for the concerns that we're worried about, seeing post-pandemic. But the good news is that there are treatments, there are supports that families can rely on, but they're significantly under-resourced, and they're not enough available. So that is something we really need to be thinking about as we build back this country.
You anticipated my next question. Is in that area, where do we need to increase investments? Is that in behavioral health? Is it in public health offices? Is it in school counselors? All of the above?
All of the above, absolutely. I think about maternal mental health is a critical component for the economy. We need to have women who are feeling, capable of bringing their full selves to work and to their families. And we need to have strong infant and early childhood mental health clinicians. And we really also need to be thinking about the underlying causes of this, right? Poverty is a major contributor to mental health concerns. So how are we addressing poverty in communities is something that we should be thinking about as well.
Absolutely. And as I spent some time working at legal aid, and that those lessons I learned there, people don't struggle by choice. And a lot of people had unpaid medical bills or lost a spouse or a job and just needed some help getting through. But, all the anti-poverty measures that we can do, whether they be investments in healthcare, affordable, accessible healthcare, higher education being affordable and accessible, all of those community resources are so important. Those dollars go right back into the community and support our local businesses as well. The people who are struggling, they're not going to save the money. They need to buy groceries and pay their rent, and so the dollars stay local. But we need to address all of those sort of underlying causes, and it's a good conversation to have now that we're in a pandemic, but always to look at those issues. So right now, the cost of childcare is a real concern. In some places, it's doubled. It was already expensive. So many families were already priced out, even if they could find childcare. Oregon has childcare deserts in all of our 36 counties. So this is something that I'm working on in Congress, because we want to make sure that childcare is affordable for the families, but we can't just lower the cost for them, because the providers are already oftentimes making poverty wages. So we're looking at an investment. So can you think of what's the best way that Congress can help reduce the costs? We're trying to get those dollars out there to make sure that we have affordable, accessible. And where do you see that making a difference?
You hit on something that is so critical. Even before the pandemic, we were in a crisis when it comes to childcare. Parents could not afford to pay any more, and early educators could not afford to be paid any less. And so we need to be thinking about how we can build back this system. And so one, we are hopeful that there will be, this additional $50 billion investment in childcare. And that sounds like a big number, but when you think about this as a public good, when you think about the fact that parents cannot get to work without childcare. We know that 40%, 47% of family, women in particular, have reported that they were going to lose their job or have to quit their job because they did not have childcare. This is a broken system that is in crisis. And so making sure that we have direct payments so that we can ensure that there's access to high quality early learning and childcare, that providers are paid a decent wage. We know they are working. This is not an issue of not working. They are working their tails off and they still cannot make ends meet. And the Child Care for Working Families Act, which you were an original co-sponsor, is a critical component to this that we hope will get passed sometime soon.
We're working on it. We did get 39 billion into the American Rescue Plan that we sent over to the Senate, and an additional $1 billion for Head Start, and also the child tax credit, which is really going to make a difference in helping to lift children out of poverty. So yeah, this is something I'm very committed to, and we think about, when you mentioned how hard it is for families to try to manage. Disproportionately affecting moms, disproportionately affecting women of color, oftentimes childcare providers. But I've had conversations, it's not just who you might think like the frontline workers. I've had conversations with universities, researchers. It's affecting people in all different areas of work and life. If they can't go to work and know that their child is safe, we're not going to get our economy up and going again. So right now, parents have all these multiple demands, navigating the remote learning for those with school-age kids, this childcare struggles, working from home for those fortunate to still have a job. So where do we need to increase investments, and what can we do to help the parents who are are really feeling the stress now of trying to juggle. And again, this is, there are people who are able to, hire a teacher for their kids in the pod, or there's others who are able to make it work because they have resources, but there's huge equity issues with that. So how can we make sure that we're really getting support to everyone who needs it to get through these challenging times?
You mentioned the child tax credit, and that is something that we are very excited to see. That this is something that will, it's refundable. We want to make sure that every family has access to this. We know so many families on the, on the lower end of the pay scale were not accessing this, and they're the ones who need it the most. And so that is critical. Being able to rely on this every month, as opposed to, at tax time, it's a huge investment, and we know it can cut child poverty, especially in families of our communities of color, in half. And so this is a no-brainer, and it's really a story that needs to be told, that when you invest in children, when you make sure that children are taken care of, we all thrive. This is an issue of national investment, that children's well-being is our national well-being. And so that's something I think is really important. Of course, investing in childcare is another big one, and paid family leave as well.
And Myra, I'm so glad that you talked about it as an investment, because that's what it is. Yes, there is a price tag, but this is an investment that actually, when we get our kids off to a good start in life, it is a very good investment, because then they enter the K-12 school system ready to learn, and they'll have a brighter path ahead of them. So it is a good investment to make sure that our kids are getting a good start in life. And we have a lot of talk here in Congress about infrastructure. And after we get this relief bill passed, next on the list is infrastructure. But infrastructure is not just roads and bridges. I mean, I think of our public school system and our childcare system as infrastructure. So what infrastructure changes do you believe we need to better support our families?
Care is infrastructure. There is a full range of care, from paid family leave, child care, and community-based care and long-term care, that is, all families at some point in our lives will have to rely on that, on one of those or multiple of those issues. And we need to invest in that infrastructure. We need to be paying our workforce across that spectrum a living wage. We're paying for it one way or the other. If we don't have living wages for folks, if we don't have a care infrastructure, then families are suffering, and we're paying on the back end in other types of public investment. So why not do it in a way that is really building on the fabric of this country? So care infrastructure is huge. And then, of course, I think the child tax credit is a major part. This is infrastructure in terms of young children's development. The children are the fabric of this country, and we need to invest in them now, and not just assume that we're going to, kick the can down the road.
Right. And I, pre-COVID, one of the things that I do as a representative in Congress on the Education Committee is go into schools and talk with children and students, and it gives you hope for the future. And when you really see the potential that's there in these kids, and how they can learn and thrive and become contributing members of our communities, it's very, very exciting. I look forward to those days again, when I can actually be in schools talking with students and educators. It's so important. And that infrastructure, the caregiving infrastructure, there are many people, and I went through this at one point in life too, in that sandwich generation, where you're taking care of kids and you're taking care of aging parents at the same time, and then you're working, and you got a lot of balls up in the air at once. So it's a tough time, and I'm grateful that the Biden administration is really talking about the value of caregiving. And as you mentioned, from young children to our seniors. So I want to see if there's other questions. Do you have some messages of encouragement for parents and caregivers? It's really, really a tough time right now. And, as parents are telling me, they're really struggling. It's stressful. They're worried about safety. What can we do to encourage them to get through this and come out on the other end with their positive attitude and good health?
Well, one thing I would say is you are not alone. and that's both devastating to think about when you think about how many families are struggling, but also the power of your voice is so critical. I can tell you, I have many colleagues who are working tirelessly on behalf of families, but I think I'm thinking of you as, member of Congress, you don't want to hear from me. You want to hear from parents. You want to hear from families, from people who can tell you directly how they're faring and how they're really struggling. And so what I would say to them is tap into this if you can. You have an extra 5 minutes. Send letters to Congress, call your representative, and share your story so that we will have this groundswell, because there is real power in our individual and collective voices.
I'm glad you talked about the story part too, because when we talk about policy in the abstract, it's not the same as talking about it in terms of this is how this particular policy will affect the people we represent and their families and their children and their community. So those stories make a difference. It makes it real. It puts it in a human context. So I'm glad you mentioned that. And I agree that I know the people out there are, especially with working parents and struggling, if you can take a minute to send an email, write a letter, call, get in touch with us through our websites. Just please share your stories, because the policy that we're working on, we want to reflect the needs in our community. So it is a really challenging time, and I'm so grateful for your work and your expertise. It has been wonderful to have this conversation with you. We know when families are ready to get back to work, many are always. I always look at it as if you're a parent, you're always working. But when parents are ready to go back out, those who have been working from home or those who need to find a job, if they don't have access to affordable quality childcare, the economic crisis is not going to end. And we're already hearing about parents looking for, hopefully they're going to get back to work, working on reopening our schools. I'm grateful that the vaccine distribution is ramping up and getting teachers vaccinated and getting kids back into school. But if there isn't childcare for those young kids, it's going to be really tough. And I think I mentioned earlier in some conversations that when I speak with teachers who are doing the remote learning now, they say a lot of their middle school and high school students have little ones on their laps because they're taking care of their younger siblings. So they're trying to do their schoolwork and learn, and they're taking care of their younger siblings because we don't have enough affordable, accessible child care. So I know there's a lot of work to be done. Looking forward to working with my colleagues in the House and the Senate and in the Biden-Harris administration to make sure that children and families have the support they need. So I'm looking forward to making that progress. I always look at the work and ask the question, is this going to create a better future for our children and generations to come? And I know that you, Myra, with your work, that is your focus as well, as creating that better future. So I appreciate the opportunity to talk with you. Do you have any closing remarks you'd like to make to the parents and families who are listening today?
No, well, thank you for this opportunity. We would love for your parents, the parents who are listening, to join us. They can go to our website. Thinkbabies.org is a great place for folks to learn about how you can use your voice to make a big difference in the lives of young children. So please go there, sign up for our policy network, and you can learn more about these issues and how to activate your voice on behalf of young children and your families.
Thank you so much. There's so many things we can do to create that better future. So thank you, everybody. Again, really appreciate the opportunity to talk with you. Take care.
Thank you so much. You do the same.